Hey guys, welcome to week 33 for me. Pretty exciting. Today I'm 33 weeks and 2 days. And yesterday I went to the doctor, so I wanted to go over that with you guys. And yesterday was also my birthday, and that was pretty cool. But first up, the doctor. I finally got to see the new doctor. Yay. It was great. When we got there was no one there. It's like beautiful. Because the other place I went to, there's always like 10 women there waiting to be seen, and it'd be about a 2-hour wait just to get in. And for us, we got in about 5-10 minutes maybe, and then we were in the room for a little bit just because they had to get my file together. But let's see, my blood pressure was 128/81. I had a trace of protein in my urine, which I'll explain in a little bit. My weight, according to their scale, I had gained 5 pounds in 10 days. But it could just be the error from the scales, or could have just been water weight, or the baby. I don't know. But I'm not too worried about the whole 5-pound thing, because it's probably just the scales. And the doctor, she's going to start sending me for non-stress tests starting next week. I'm not too worried about. I guess last time I had an ultrasound, I forgot to mention that my amniotic fluid was a little elevated, just slightly, not too much. So she's going to have me monitored for that, and also for the blood pressure and for the protein. She's also going to send me for another ultrasound to check on the fluid and to check on the size of the baby and whatnot. When we were there, she was kind of confused as to why my due date, or what was going on with my ultrasounds, because one of them said this and one of them said that, and she was just kind of confused. So she has to order my very first ultrasound and see why they didn't change my due date or something. She was great. I mean, she sat there and she talked with Chris and I, and just like, any good doctor would do, and it was kind of like an orientation over again, just talking about our labor plans and making sure that I'm not eating processed or unpasteurized stuff and stuff like that, just the normal stuff they tell you during pregnancy. She also wanted to ask about my history, my medical history, even though we had gone through it last time I was there. She wanted to go through that, and I think that was it. I'm going to be seeing her on the 31st again, and I'm waiting to get a phone call about my ultrasound. I'm really excited that I get to go to another ultrasound. And the NST testing, I'm not too worried about. I know might be kind of a hassle, because it could take anywhere from an hour to like 3 or 4. But just to make sure baby's safe and I'm safe, and that's fine. And I feel great. Oh, she gave me, she's making me do another 24-hour urine sample, just because my 24 was elevated. She said it was 420, and she said they'd like it to be about 3. So it was elevated, so she wants to do it just to get a baseline. And basically I asked her why I was classified as high risk, because I was kind of confused. And she said basically, whether it happens to you once, twice, or like 5 times with the protein and your high blood pressure, once your blood pressure elevates the way it does, or way it had with mine, they have to keep a close eye on me. But I didn't understand the chronic hypertension. But she said that doesn't matter. That doesn't need to be labeled. Just that it's an issue now. Which is good, because I was like, thank you for just telling me that. Like, that's all I really wanted to know. Because I was kind of like, I don't have chronic hypertension. I was fine before pregnancy. So it was just the fact that my blood pressure rate was risen for a few weeks, and I had some protein in my urine. there's an issue. So, that was it. She checked her heartbeat, said her heart was great. And I didn't notice, I didn't see what my fundal height was, but Chris said it was about 36, which is about where it should be, where it's been measuring. So, other than that, I've been having Braxton Hicks all the time. Yesterday I had him all day, and it was consistent. It was like every 5 minutes, every 5 minutes, every 5 minutes. And, well, it wasn't all day. It started probably around 3, I think. And I would be standing there, and it would hurt, and I'd like kind of curl over a little bit just to let it pass. And it hurt. It wasn't, unbearable, but it was totally uncomfortable. So finally they let up around excuse me, I was hoping not to yawn in this video. They let up around 7 or 8 o'clock. They were still happening, but they weren't as bad. And then when I got home, they went on pretty for the rest of the night, really. But I knew they were Braxton Hicks. I didn't want to, go to the hospital for no reason. I wasn't having any discharge or anything. So, I guess my body's just getting ready. Because they happen all the time. I have at least 2 dozen a day. Which is great. I mean, my body's getting ready. And another thing that I want to mention is that for the last few weeks, I've been noticing that my nose is getting bigger. And I'm like, why is my nose so wide? And then I was reading, I Googled it, and a lot of women are like, oh, your nose gets big, because along with the rest of your body, your nose swells, and it'll go down after pregnancy and stuff. But I'm like, ew, my nose is huge. It's huge. But just another pregnancy symptom. I have been having a lot of pressure in my lower abdomen, kind of almost a burning sensation too sometimes, and it's like, oh, that doesn't feel too great, and it's in my area, and it's inside too, so it's kind of like well, so I mean, it's quite possible that my body's getting ready, like thinning out too, which is great and super exciting. Let's see. Yeah, my bones have been really achy lately. They've been popping and cracking, and my hips have been like jiggly, jiggly. Like you stand up, you're like, whoa. And my hands hurt, my feet hurt. I'm still swelling quite a bit, but not as bad. I'm achy from the swelling too. My body gets a little achy when after I'm swollen. It feels like I've been bruised, but that hasn't been too bad. The other day, I totally had pregnancy brain and totally forgot my car. Chris and I went down to the bowling alley, and well, we went down in separate cars, and then we went somewhere, and we were supposed to pick up my car, and we got like halfway across town. Totally forgot that we left my car there. So I guess he had pregnancy brain too. But yeah, that was stupid. And then I have a lot of brain farts too, where I'm talking and I'm like, wait, what was I saying? Huh? Yeah, that's fun. Oh, and I was watching a vlogger, and she was talking about Dr. Harvey Karp. And I haven't brought him up before, which I don't know why, because I think he's a genius. But he created the 5 S's to calm or to soothe a crying baby. And I basically, he says that babies are born in the 4th trimester kind of a thing, and they have these 5 things that should calm them down. It's swaddling, shushing, swinging, sucking. There was one more. I can't remember right now. But he's a genius, and I recommend all women out there look up Dr. Harvey Karp and the 5 S's. It'll really blow your mind. When I saw the video, it was like this baby was hysterically crying, and then he did this thing, and I'm like, what? How'd you do that? Because I've worked with babies before who just won't stop crying. It doesn't matter, and it takes a toll on you. So anything that could help, check it out, definitely. Oh, and lately I've been finding myself checking for my mucus plug. Like every time I use the restroom, and sorry if this is TMI, but I use the restroom and I wipe and I'm like, nope, no mucus plug yet. And I know that it probably won't happen until I'm about 36, 37, 38 weeks. But I'm hoping. And I'm like, I'm ready. Let's see what this thing looks like. And no mucus plug yet, so I'll let you guys know. And again, I've been tired a lot, just like in my last vlog. I told you guys I've been sleeping a lot, nap all the time. Yesterday, which was my birthday, I only got 5 hours of sleep, and then I was up all day, and we were running around, and we went here, and we went there, and I didn't nap. And at the end of the night, I was like a zombie. I got home and my dog was doing this weird thing to me, and I just like hysterically like fell over laughing. I was so tired. But well, it's pregnancy, I guess. My first trimester I was like that, and I'm ready to have this baby. That's what I'm saying. So I want to say thank you to all the new subscribers and everyone who watches my videos. It's really exciting. And let's see, I think that's it. I want to show you guys my belly. Sorry, got dry mouth. Yeah, let's see my belly, guys. Let's check it out. So, that's my belly. And let's see. I feel like she's totally out. I really feel huge. This woman yesterday was like, "Are you pregnant?" I was like, "Oh yeah, no, I'm not. I'm just carrying a basketball in my stomach." My friend. But yeah, my uterus is up here. You gotta see. She's a big baby. But yeah. I think it's funny. Maybe the woman was trying to be cautious or something. She was totally like, "Are you having a baby?" No, I'm not. Just kidding. Okay, guys. So that is my week 33, and I'll talk to you guys next week after doctor's appointment. And yeah, I hope you guys have a great one. And a great rest of March. Yippee. All right, see you guys later. Bye.